Good afternoon, everyone. Welcome to this breakout session. I know that there will be additional people slowly trickling in as we all come back from our break, but I would like to welcome you on behalf of Dr. Holtrop and myself. We will introduce ourselves first and then allow you to introduce yourselves. And since we have a smaller group, we might just go around to generate some knowledge, and then we will do a brief presentation and open it up for discussions. So my name is Borsika Rabin. I am faculty at the University of California, San Diego, and I also have an appointment at CU in Denver. And I've been working with Dr. Holtrop for many years now in the context of the Accords D&I program. And I will hand this over to her.
Hello, good afternoon, and thank you for hanging in there to the last session before the closing remarks on a 3-day virtual conference. We're really glad you're here. I'm Jodi Holtrop from the University of Colorado Dissemination and Implementation Research Program. I'm a professor and vice chair for research in the Department of Family Medicine. And I think that's probably enough. Go ahead, Borsika. You're on mute still.
I'm sorry, I got stuck. So hopefully you can hear me now. Since we have a smaller group, I would like to encourage you to, if you are in a position, unmute yourself, turn on your camera if you can, and introduce yourself and perhaps your affiliation. I'm going to take advantage of Erin's bravery of turning on her camera first. Would you like to start, Dr. Kenzie?
Sure, I just popped in, but you're just asking for introductions. Is that what's going on?
Just the name and affiliation. Yeah, we are a little bit small. We will start with that. And if we grow too fast, we will go into the chat.
That's great. Yeah, my name's Erin Kenzie. I'm with the Oregon Rural Practice-Based Research Network at Oregon Health and Science University in Portland, Oregon.
Thank you. Welcome. Please, I will call out names as I see them. I'm going to do first names. I apologize for mispronouncing. Milena?
Milena, yes. Hi. Yeah, Milena Summerall. I'm a retired educational researcher, and why I'm here is because I am on advisory councils for different grants that Dr. Benzie Kluger is working on. So I'm trying to be a better supporter.
Wonderful, welcome. And Emily?
Yeah, hi, I'm Emily Godfrey. I'm an associate professor of family medicine, practicing family physician at the University of Washington in Seattle. And I study sort of how we can implement change in primary care practices.
Welcome, thank you so much. And now I don't see names for those of you who have your camera on. Let me see if I can trick it. So please just jump in.
My name is Daniel Shattuck. I'm a research scientist with the Pacific Institute for Research and Evaluation in Albuquerque, New Mexico.
Thank you so much.
I can call on people. Kathleen?
Hi, my name is Kathleen Albers. I'm at KPCO as a data specialist, and I'm new to this whole world, and so just here to learn.
Love your background.
Thanks.
Katie McGidd?
Hi, I'm Katie McGidd. I'm a health science specialist at the Denver VA.
Wonderful, thank you. Stephanie Blackstock? You're on mute. We'll go to Brett. Maybe calling on people isn't the best approach. Janet? We're catching people off guard.
Yeah, perhaps those of you who are unable to join with camera or voice, please put your name into the chat and your affiliation. And Connie, I see you on camera, so I will take advantage of that. Jodi, we will tag team this.
Oh, there we go. Hi, I'm Connie Chavers. I work for LA County Department of Public Health for the Division of HIV and STD programs, and I'm in a section called Planning, Development, and Research, and I'm on the program evaluation team. And So we are trying to make sure that what we are implementing to try to prevent HIV actually is effective, and especially with the Ending the Epidemic initiative. And my boss's boss was so excited about this conference. She wanted us all to come and learn so that we'll be more prepared to do the kind of interventions and evaluating them that we need to, to be successful with this strategy.
Thank you so much, Connie. Welcome. Wonderful to have you. I think there is Tarek.
Hi everyone. I'm Tarek Walker. I'm a physician scientist at Anschutz, and in this moment, I'm also kind of multitasking with a little bit of homeschooling today. It's finals week for several of my kids, so apologies in advance if I can't be reached during certain spots during this incredible meeting.
No problem. Thank you for coming on camera. And I think we called on everyone, and we will stop harassing you, but thank you so much. I feel like what we lose with this virtual format is the less face time, and we would like to encourage you to be with us whenever you can. So what I'm going to do now is I'm going to share my screen, and we have a few slides with Dr. Holtrop where we were going to share some thoughts about how to think of multi and mixed methods approaches in documenting and analyzing adaptations in real world settings. And one of the things that I am thinking of doing is not putting this into presentation mode, if you are all okay with it, so that I can see the photos and see reactions as well. So if you all can see this well, then I'm going to get started. Jodi, how do you feel about it? Okay, wonderful. So what we are going to do is we are going to tag team this. First of all, we wanted to acknowledge that most of the things that we are going to talk about, perhaps all of them have been created in collaboration with other colleagues. And this is just a sample of the different people who have contributed to the knowledge that we are sharing here. Also showing you a wide range of colleagues and groups that we are working with Dr. Holtrop. Today's session was focusing on three main areas. We wanted to provide you with a general understanding of key concepts of adaptations as they relate to documenting and analyzing adaptations. So our task is to focus on that end of the spectrum. We also are going to review and compare some key strategies for documenting adaptations, pre-implementation, during implementation, and during sustainment. And finally, thinking about the analysis piece, what kind of methods can be used to analyze information about adaptations in these different stages. Parallel to this session, there are some other sessions that are focusing other aspects of adaptations, and you will be able to look at the recordings after the conference to catch up on those and look at the slides and handouts. I will also take the opportunity to remind you that we provided a one-pager that includes some of the key concepts from this presentation, and it's uploaded to the website so you can access it there. So we are going to start with a poll. So we are engaging you again. And so I will ask you, I think I'm going to actually go low tech here. That's my current feeling, and ask you to look at this question and put in the chat the answer option or options that apply to you. And the question is, what is your experience with adaptations in your current projects? And the options are, my project has made planned adaptations, A. B, my project has made unplanned adaptations. C, my project has made both planned and unplanned adaptations. D, my project did not make any adaptations, but they are happening on the ground. And E, we did not make any adaptations at all. So I will ask you to put your responses in the chat so we can see what is your experience with adaptations. And I see some answers coming in. So far, D, C, D, D, A, C. There is a mix of B, C, and D. And then another D. So some of you, or a good number, mentioned that they did not make any adaptations in their project. Others have acknowledged that there might be some planned or unplanned adaptations, or a mix of those. And then again, others mentioned that they think that the project did not make the adaptations, but they are happening on the ground. So I'm just looking at, so this is helpful to understand. I think it's a pretty common set of answers where people are often observing adaptations on the ground, but not yet intentionally planning those or documenting those. So we will move ahead and look at some general concepts and then move into the next section. I'm sorry. So this definition of adaptations will be relatively familiar to you after Dr. Moore's presentation earlier, and then all the other sessions that happened even the day before. Generally, the way that I am thinking about adaptations is to think of them as changes or modifications to an intervention, an implementation strategy, or the context. And most of these changes or modifications can be intentional or deliberate or accidental or unplanned. They are often made to improve the fit or compatibility of your intervention or implementation strategy in a new context to a new population or setting. And they are very common, and often we believe that they cannot be avoided because there is a need for adjusting to the new context. But there is a concern as well that as we are making adaptations, and I know that in some of the chat comments during Dr. Moore's presentation was that we might be lessening the effectiveness of an intervention, or we don't even know what's happening as we are constantly changing things. So there is definitely this tremendous tension between internal validity and external validity, fidelity and adaptations. And in the past, we were mostly focused in our work on fidelity. That was the good guy, and all adaptations were to be avoided. Very often they were referred to as protocol deviations, and certainly we didn't want to say that we are going to measure what happened, how we changed the protocol compared to what we planned. More recently, there is a lot of focus on finding a way to balance these two and see them both as good guys necessary for the appropriate implementation of a program and sustained use. So basically, we can say that adaptations are not good or bad. They do happen, and they are inherent in this complex intervention process that, again, Dr. Moore talked about really nicely today. In fact, when we are not attending to adaptations, we might actually cause some tremendous trouble because the intervention will not be implemented in the new context, and that will also result in implementation failure and no effectiveness. So we feel, in our work that adaptations cannot be suppressed, they need to be attended to. And so we will give you some ways that you can think about that. I also wanted to just remind you, as we are talking about adaptations, most of us are working with complex, and as Dr. Moore said, different from complicated interventions and different types of interventions. I really like this definition of evidence-based interventions from Hendricks Brown and colleagues that conceptualize interventions in these 7 Ps and acknowledges that interventions can be very diverse. They can be principles, procedures, products, skills, policies, programs, and practices, depending on what field you are working in or what program you are engaged with. And then a final kind of preliminary slide is to say that often our solution to adaptations and fidelity is to say, maintain fidelity to the core components and adapt the periphery that can be changed. However, when you come to complex interventions, this distinction of untangling what is core component and what is a discretionary periphery is a little bit more complicated. And so often that simple advice in practice becomes very challenging. And so as we think about adaptations and how we decide on what to adapt, we need to consider this complexity, and it's not going to be as easy as A and B. So moving on, I'm going to start to talk a little bit more about the main focus of this presentation, documenting adaptations, and invite you to another poll where we are asking you to put into the chat, how are you documenting adaptations in your current project or projects? And the options are A, not documenting them, B, systematically and comprehensively documenting them, and C, pragmatically documenting them. And so I will give you a few moments here to respond. So Dr. Kenzie mentioned attempting B, so systematically and comprehensively documenting. Looking at her work, I will attest to that they definitely are doing a wonderful job. And then we see another B, more Bs and some C, B and C, mostly A, but attempting C, wonderful. And then A. Nice mix of responses and experiences. So it sounds like most of you have done made some attempt to try to document the changes, the adaptations. Perhaps some of you are newer to this. I think that perhaps one thing we can agree during this presentation is that a good starting point for dealing with adaptations is to document them, to document what's happening on the ground and find ways to do it that fits with your project. And so I would not say that B is better than C necessarily, because in some cases, B is in the way of anything happening. I know that our work with colorectal cancer programs in underserved communities, we have been talking about cross-program documentation of adaptations, and some programs are not set up to document adaptations systematically and comprehensively, and so they basically shied away of doing anything. However, when we had a discussion about finding some minimum way of tracking those, for example, during a meeting, just asking a question about, did you have any challenges putting this program into place? And during those challenges, did you make any changes to address those challenges? That is already a way of documenting adaptations, and that very small way of collecting data is much better than nothing. So I would say that B and C will depend on your context and level of resources and expertise on your team, but I would certainly recommend for everyone to move into the B or the C section of the answers here. So why would you document adaptations? I already hinted a little bit that, the idea of knowing what's actually happening is important. This can help you understand why you see certain results, potentially lack of effectiveness. You might be able to provide an organized list of adaptations that worked well in your study for future implementers, and they can benefit from that. It also can help you refine the intervention. In some cases, it's happening actually during implementation that we make changes. And in other cases, after this study, you might change the intervention or the implementation strategy to address some of those adaptations. And in the long run, and Dr. Holtrop will talk about this a little bit, we have done less with describing the impact of adaptations. The MEDI framework that Dr. Holtrop will briefly touch on, and just in her work, we are starting to think about how can we systematically understand what impact the adaptations have, both on implementation and effectiveness outcomes. And so not to scare those of you who have not been have not encountered the frame, but this framework is the most comprehensive guiding framework of thinking about documenting adaptations. It was developed by Dr. Wiltzie Sturman, Anna Baumann, and Chris Miller. And this is an updated version. There was an original one, and this is kind of the version 2.0, based on a review of the literature, really detailed and comprehensive. And again, as I mentioned before, in some studies, using all of these concepts will not be possible. But it's certainly a beautiful way of thinking about adaptations in a very complete way. Sometimes you will take subcomponents of this because that's all that your study can carry, and that's okay. And then, kind of highlighting that idea in our work, and I will share a study that we have done in the VA in our query program. We created a simple version of thinking of adaptations. As part of this, we identify what the adaptations happen to. So is it an intervention implementation strategy or context adaptation? And then we think about the time point when the adaptation happens. And we believe that that's important because we expect that the types of adaptations and the frequency of the adaptations will change depending on where you are with the implementation of your study. Seeing different kinds of adaptations in pre-implementation, then during implementation and during the sustainment phase. So starting to understand this better. I also wanted to highlight that there are different methods to capture adaptations, and I will show you a little bit more about it, but they range from high intensity observational methods to, again, the method that I just mentioned, that during the meeting, you ask questions as part of the meeting as a routine way of reflection, and anything in between, including focused interviews, questionnaires, surveys, and content analysis and study databases. So I'm specifically going to very briefly show you a study where we used adaptation tracking and multiple methods across 4 projects. And then I will show you the results from one of the project analysis. That's the one that we have complete and published. So as I mentioned before, one of the key pieces in documentation of adaptations is the triangulation of data. And so as you can see in this study, we had 4 different methods of capturing adaptations, but there could be some other ways of getting to this. And I'm sure that you could add additional circles. But across the 4 projects, we used different combinations of these 4 methods that you see in the middle. This is our interview guide, and this is available freely, so we are happy to provide you with. And this is our real-time tracking form that just showing you how simple it is. It is an Excel file, basically. And then the specific study out of the 4 that I am showing some results for used these 2 methods. Other studies also use process map and meeting notes in addition to these 2 to capture adaptations. And what we have found, you can see here, that there is kind of a variation in how many adaptations happened in early and later stages in the project across the 5 sites that were included in this one nurse practitioner focused study. And also you can see, and I am showing this very briefly just to show what type of data displays you can generate, not so much for the content, but you can organize these adaptations based on some of the frame categories that I showed you earlier, that complex framework across the time points and the types of adaptations that happened. The key findings were that we were able to do a longitudinal assessment and the documentation of adaptations. We also found that when we look at the different types of data sources provided different type of understanding of adaptations, and certainly a richer understanding, but we still found it critical to go back to the implementers and member check on how we interpreted the adaptations. I will highlight a couple of more things. One of them was that even though most of our adaptations were very intentionally planned, and there were some non-planned or reactive adaptations as we categorize them, the fact that they were unplanned in the traditional sense of a team sitting down and providing some theoretical basis for the change, they didn't result in bad outcomes because they were still thoughtfully created. And so as we think about the difference between planned and unplanned adaptations and their impact, we'll just have to think about how to interpret those findings. And then finally, in our study, we did not have a good way to assess the impact of adaptations other than some subjective perceptions of the participants. And so that's certainly an area where more advancement is needed. And then as my last slide, I am going to just show you that more recently we have used this methodology in other studies. This is a COVID-19 study for underserved population testing. And we turned our method into a REDCap survey, which we are happy to also share. And we are entering the data that way to make it easier to analyze it. And with that, Dr. Holtrop.
All right, thank you. So the title of our presentation has to do with multi-methods and mixed methods. So we need to spend just a couple of minutes on this. So multi-methods is when you're using more than one method. So it can be 2 qualitative methods, 2 quantitative methods, 1 qualitative, 1 quantitative. But the difference with mixed methods is that you're using both qualitative and quantitative data collection. And then, you might analyze them separately, but at some point they're mixing, they're integrating together. And I'm a good friend of Mike Fetters at the University of Michigan, who leads a lot of mixed methods research workshops. And he always says 1 + 1 = 3. So it's great to use multi-methods, but if you use mixed methods, you can get something greater than the whole of the 2. Go to the next slide. Borsika is going to slide advance for me so we don't have to go back and forth. So Borsika did a great job of talking about what are some ways that you can collect data. and then a little bit about descriptive, how you can describe what you're doing. But we also want to talk about how you might analyze the data that you've collected. So really this focuses on methods that we know already, or that you maybe want to know if you don't know yet. Qualitative methods, so thematic analysis, grounded theory, etc., are some of the methods that we would rely on. So if you're doing interviews, observations, other kind of text data, you can analyze that by a traditional qualitative analysis. I didn't put on here, but rapid analysis is getting very popular, and that also might be a really great analytic method for qualitative work, especially kind of adaptations that are happening fairly quickly that you want to study quicker. And then there's also the basic quantitative methods like statistics and cluster analysis and things like that. And those can get used somewhere. So you can use those independently, but mixed methods are something I'd like to just spend a couple of minutes on. And so with mixed methods, you're doing two main things often. The joint display analysis is an example of how you might compare qualitative and quantitative data. So you're going to kind of put those two types of data up to each other and then try to see how they are alike or different. Are they telling you the same thing, or are they telling you something different? And configurational comparative methods, or CCMs, in which there's two main methods, qualitative comparative analysis and coincidence analysis, or QCA and CNA. I'll spend a little bit more time on those, are another method where it's essentially you're doing mixed methods by transforming one type of data into another. So you're taking a qualitative set of information and turning it into quantitative. So that's just kind of an overview. Next slide. So here's an example of just a made up example from a study that we're working on right now of a joint display analysis. This is a very basic one that kind of gives you a shell. And so what you would often do when you're trying to compare qualitative and quantitative data is look at what your qualitative themes are, and then your quantitative result, and then have a column that will talk about, are those alike or different? How are they alike or different? All right, so you're collecting descriptive information about the adaptations. Here's an example that qualitatively you might learn that adaptations occurred in both the implementation or the process aspect of a project and the delivery of the sessions. So maybe it's a program, and you also noticed that there were adaptations to the content. But when you went through the exercise of collecting all this and analyzing it quantitatively, frequency-wise, you can see that there were both process and content types of adaptations, and that your summary is that they agree, but there's slightly more process adaptations. In the study that I'm working on right now, it's similar to what Borsika shared about the the kind of Excel tracking, so you can kind of see descriptively what's happening. So that's a very basic example. I would recommend, if you're interested in this kind of thing, Mike Fetters has a workbook called the Mixed Methods Research Workbook, and it really takes you step by step through how to do a lot of this. So of course we can't cover it all. This is just a kind of taster, like giving you a little bit of information. The other table that I have there is just talking about what you can get from different methods when you use different methods. So in this case, in the study that I'm working on right now, we measured adaptations by looking at interview data, observation data, and field notes that coaches took. And when we looked at all of that, there were 202 different adaptations that happened, and we found them from a variety of different methods. So using different methods will get you different types of things. And so this is the great thing about multi-methods, even if you don't do mixed methods, is to see that in our case, like the interview data was best at explaining what happened in detail and why. The observation data was best at identifying changes during the session, such as the length of time and the content covered. And the field notes were the best source of process information, given the challenges that people discussed with their coaches. And so, combining these different methods together gave us a lot more information about each adaptation and made the chance that we missed out on something much less likely. Next slide. So Dr. Rabin mentioned the MADI. This is the Model for Adaptation, Design, and Impact, is what the acronym means. Essentially, this is trying to take us from just the descriptive information you get in frame and understand the mechanisms of action and how it fits together with impact. So just very quickly going through this, the green information on the left is kind of a lot of what you'd find in frame. It's the who, what, when, where, why, you know, that kind of thing of why adaptation, you know, what adaptations happened, what were they like, where did they happen? The blue is possible mediating or moderating factors. So these are what happened contextually, what happened, you know, the why, those kinds of things, what was the goal, etc. And then you utilize both those sets of information to get to you to the orange, which is the outcomes. And you'll see there that it's got intervention outcomes and implementation outcomes that help you get to your overall impact. So that's the $1 million question, isn't it? Do these adaptations make things better? You know, that's what we want to know. Does it actually make the core components fit better in the context? So this is kind of the holy grail here. This is what we want to get to. But what kind of methods do we use to get there? So next slide. So one of the things that I think has the most promise is configurational comparative methods. I'm only spending one slide giving you a very brief overview, but you can go look this up and learn about it. I myself have used QCA several times. I think it's a wonderful method for doing this. And what it is, it's a family of methods that allow you to look at program features, contextual conditions, and examine relationships with outcomes in a way that is configurational. So that means that you can look for, okay, in this setting, in this context, it was A, B, and C that mattered. But in that other setting, in that other context, it was D, E, and F that mattered, you know? So it allows you to kind of look at these relationships. It is not a statistical method. It is based on Boolean algebra. It's kind of a little bit more like computer programming, you know, like what kind of switches need to go on to get the light bulb to turn on, you know, it's more like that. It does start, QCA and CNA often start with some qualitative information that gets quantitized. So that's a data transformation process of taking qualitative and turning it into quantitative data. And so there's a lot of things you got to watch out for if you do this. And I definitely recommend like working with a consultant, but I think it's really, really a great method for doing this MADI framework. You know, it's or model, that is a model. But it's a great way of, you know, getting at what are the necessary and sufficient conditions, which can include adaptations. And I you know, wanted to just at least introduce you to this. So you can go to the next slide. So here's a bunch of papers. You'll have access to the slides, and that highlight some different methods for capturing adaptations. So I won't go through them all, but you'll see that MADI is there in the middle left. Frame IS is there in the middle right. So Frame IS is the frame extended to implementation strategy. So there's another reference for you. On the bottom part there, left and right, this is where this group has tried to apply kind of that conceptual modeling with MADI. And on the bottom right, they talk about how they applied coincidence analysis, which is one of these configurational methods, to looking at the success of colorectal cancer screening outreach. So they considered the different methods of outreach as adaptations, and then how, you know, how different sites chose to go about that and, you know, what seemed to work. And so it gives you a practical example of how coincidence analysis is used. Let's go to the next one. So we're going to talk just very briefly, I'm almost done, and then we can have a discussion about some resources. So one resource is, you heard from Graham Moore this morning. This is his group, all right? And they commissioned this work called the ADAPT study, and there's the website, so you can go find it. But they did a comprehensive review, systematic review. They did qualitative interviews with a whole bunch of people, and then they did this expert consensus process to develop guidelines and recommendations around measuring and evaluating adaptations. And it's really good to go in and look and see at what they did. I mean, what they're really trying to do is say, it's really best to take evidence-based interventions and adapt them, then start from scratch all the time, if you can, if it makes sense. And so we better know how to do that. And so this is guidance related to that. Next slide. There's also an adaptation, fidelity, and tailoring group, which Dr. Rabin can talk more about, because she's, if you have questions, she's one of the co-chairs for this. But it began a few years ago and started with a VA query program, but this is open to people in the VA and not. I'm a member and I'm not in the VA. They have monthly discussions related to these topics. So lots of things on adaptation. So it's a great forum to be part of. You can sign up, get on the list, and then you'll get emails from Christine Kowalski at the University of Michigan VA inviting you to the different presentations. Next slide. So here's a quote here from Bauman, 1991, getting a little old, but it still makes sense. Implementing a program is like constructing a building. An architect draws upon general engineering principles, which is their theory, to design a building that will serve the purposes for which it's designed. However, the specific building that results is strongly influenced by lots of things, like the building site and the lot size, et cetera. So the architect must combine the architectural principles with site parameters to design a specific building for a specific purpose on a specific site. This dynamic is mirrored in the rough and tumble world of human services and like what we're all trying to do. So despite excellent plans and experience, ongoing redesign and adjustment may be necessary. And the more that we can do with our methods and our, collecting and understanding, that more that we can understand and help support the kinds of adaptations that need to happen to make things better. I think this is yep. So in summary, embrace adaptations because they're there, they're going to happen. So let's try to figure them out. And they're best made when based on data and evidence about, the who, what, when, where that works. And many methods can be used to identify what occurs and their effect on outcomes. So I think okay, so there's some resources. And then this is a fun slide from Dr. Rabin here. Bird adaptations. Bird beak adaptations. All right, so we have some time. We wanted to save some time for questions. So would you please go ahead and just start? You can either type your questions in, we have 8 minutes left. Type your questions in the chat or just unmute and go ahead and ask. Was there anything that you needed some clarification on from our presentation too? Feel free to ask about that. I know we did not teach you everything.
So I have a question. So I feel like trying to capture all these adaptations can be, at least as a PI, it can just be difficult to sort of oversee and capture because people, you have people on the team who are, sometimes on the ground in the clinic or whatever, and adaptations maybe, sort of occurring ad lib. I guess the question I had is that in terms of sort of more setting up sort of a methodological way to capture all the adaptations, to me, it seems like the REDCap survey example that you had may be the most efficient or practical way to have something to review in the end. And I guess I'm just wondering if there were other sort of systems that you had in place. I mean, I don't know if you're just capturing sort of notes and keep them in a notebook, or like how kind of the way in which you're capturing all these adaptations.
So in our case, we are using now most recently this REDCap survey. So wherever they come from, even if they come from interviews, we eventually enter it into the REDCap survey. And I don't know if all of you are familiar with REDCap. I got acquainted with it more recently, but it's basically one of those survey programs that most of the CTSIs or other schools have. So it's just creating a survey interface with all these different aspects of adaptations, and we enter them. And so the source is well entered. And then at the end, we have this database, which is basically, if you pull it out, it's an Excel file that has all of them taken care of, and you have a list of them and the timing when they were made, etc. And then the work starts with cleaning them up, linking them. Sometimes the same adaptation is entered from different sources. So you have to make the connection that this is the same thing. We heard it from different people, or we heard it from different sources. But the way that we are right now doing it in complex studies is to have this one database where everything goes in. Does this answer your question, Emily?
Yes. So we have FredCap at University of Washington. So it seems like a feasible place to start.
Yes.
Thank you.
I'm happy to share with you if it's helpful. I learned that you can transfer templates of surveys. So we have been sharing it with others. So you have to still adapt it for your own study, but it's a good starting point. So let us know.
Great, thank you.
I think I noticed Erin unmuting herself, so I wanted to take advantage of that.
Sure, yeah, I was just wondering what your thoughts are on, like, what are you excited about around this whole area of research and practice around adaptations, or what do you see as kind of the near future of this research? Like, where do you see this heading, or what would you like to see done in this area?
Do you want to go first? I'm kind of multitasking QCA and CNA resources in the chat here. But I did hear the question. I think what I'm most excited about is how can we advance our methods enough so that we can untangle that ball of string that, Dr. Rabin had in her present, in one of her slides, because it's kind of like, well, okay, embrace adaptation, but what does that mean? How do we know what works when, for who, why, and do we have to do a big fancy analysis all the time? I mean, I think it helps to do sometimes to help advance the field and understand better where the kind of big ticket, items are. But that's what I really want to know is how can we be as effective and efficient as possible with what we're doing and best serve whoever it is we're trying to serve. And so I feel like we're kind of wandering around in the dark sometimes, because our methods limit us. We don't have good enough methods to kind of open up the black box. So that's what I'm most excited about, really making a difference through better understanding. The other way I would go with that is just that I think sometimes just knowing what works in like the quality improvement area, there's probably a lot more work to be done around just, I think about like learning health systems and leadership and training and all of that. Like if you have a good leader, good team, they know how to adapt things they just intuitively know that. How do we train people better? So they just know how to do those things so that out there in the public health community, healthcare world, these people know how to do it better, and then we can supply them with more information as well on how to do those things. So I don't know if that was the answer you were looking for, but that would be my answer.
That's great, thanks.
And just to add to that, I absolutely agree with Dr. Holtrop on all of these. And, for me, the question is more and more, what is the good question to ask as we are doing implementation work? Because what we learned is adaptations will happen. They will happen throughout the implementation. We had this question come up during Dr. Moore's presentation of, well, what are we testing then? If something is changing all the time. So I'm wondering whether our problem is not that they change, because that's the reality. It's how we ask questions about interventions and implementation. And I don't know the answer, but I think this is a paradigm shift that we need to acknowledge. So I'm also pointing you to Mustafa's wonderful comment that he rewrote Charles Darwin's famous quote. So please enjoy that there. And I also asked him to tweet about it because I think that's a good one.
I have a question for the group, and maybe people want to respond back, but if you have thoughts or opinions about this, is that, first we started with Shannon Wiltsey Sturman's you know, it was before frame, you know, kind of capturing some adaptations. And then we ended up with frame, and then we've got frame IS, and then we've got Maddie. And it's, you know, kind of going along this continuum. There's very little out there on the impact of adaptations. A lot of it's very much more like just descriptive, you know, kind of like, so you can kind of look at it and say, oh, okay, it was, you know, this group of people that, you know, and they did it for this reason, which is useful. Do you think it's always important to try to look at the impact, or is it just useful to kind of have the descriptive information? Like, what's the benefit of each of those things? Because obviously trying to do this whole, like if you really used Maddie, I mean, that's pretty complicated to get, you know, outcomes and then all of the things that matter that might, you know, add up to the outcomes. So just kind of like right sizing what you need, I guess. So my question is, when do you think we just need to do the descriptive? When do you think we need to do the whole kind of outcomes analysis? You know, that was just a really easy, you know, 2-second answer question. So
late afternoon, also perfect timing.
all right, I'm seeing that we need to wrap up. So because we need to go to the closing address. Sorry, I was so excited by Erin's question that I just, you know. So anyway, but thank you for your time. You can ponder that as we go, you know, the rest of your day. Sound good? Borsika?
Just a reminder to everyone, after the closing address, you go back to the main auditorium.
Thank you so much, everyone. Wonderful to see you. And if you have an answer, tweet it,